some of you who know my work know that I've been doing technology for a while. And so what I picked out to talk with you all today is a couple of things that are new that I'm doing. And so there's not a lot of kind of outcomes data, but some lessons learned that I'm hoping to share with you as we begin to think about how we develop out these kinds of programs. So first of all, let me tell you about a program that I'm doing around text messaging. And so Brian earlier this morning talked a little bit about adolescents and what texting looks like in that population. And so I'm doing a study where we're using technology, or using text messaging, for helping young people get towards HIV testing. Now, why use text messaging for that? Well, number one, when you think about how young people want to communicate with each other, text messaging is number one. They don't want to talk to you. They don't want to have conversations. They don't even want to talk on the phone. They want you to hit them up on a text message. And that's the preference even in comparison to email or anything else. So really it's about how, if we want to communicate to young people, we got to communicate in the way that they communicate with each other, which is through text messaging. So the question is, they don't want to come to these therapy groups. They don't want to have conversations about all the things that we want to have conversations about. And I have a 14-year-old, so I really do know he has no interest in having a conversation with me about pretty much anything. However, they're using text messages and cell phones all the time. One of the things folks often ask me is this question about a digital divide. And what I'm finding in my research is young people are finding a way to get online, to use phones, to use text messaging, and it's not about, and in many cases, even those who are low socioeconomic status, we're talking about African American, Latino youth, they all have some form of telephone that they're using, and they're using it on a regular basis. So if you think about the typical teen sends about 50 text messages a day, a third of them are sending over 100 text messages a day. Now, I mentioned that I have this 14-year-old, and I will tell you, when he was in 3rd grade is when he started asking me for a phone. And I'm like, no, it's way too young, although a lot of his friends had phones. In 4th grade, it was the full court press, all the time. In 5th grade, my son got a phone. Now, I'd like to blame that on his father, but the reality is, young people at the youngest ages are using these cell phones, and we need to really figure out how to get that information to them using that. So the typical number of text messages, Brian already kind of told you this morning, over 100 text messages a day. These young people are also on plans, because if you have a teen, you know it doesn't make sense to try to limit the number of text messages unless you want to have a really big phone bill at the end of the month. So they all also have these unlimited text messaging plans. So these questions about how much it costs them, how much it costs them to get information, how much it costs them for us to reach them through a text message, really are a moot point at this stage. So, so how can we get young people to test for things like HIV, test for sexually transmitted infections, all the health conditions that we really know that young people are impacted by on a regular basis? So let me back up a second though and say, well, why is it important to get young people to test for HIV in particular, right? So when I say young people, I'm talking about 12 to 23-year-olds. One piece of it is what you've heard already, that young MSM in particular, that population, that segment of young men, are really increasing at a disturbing rate in terms of their HIV rates. But the other thing is, the young people who need to test the most, the ones who are having sex, the ones who are having unprotected sex, are really the least likely to go and test. So we need to figure out how to reach, well, and the reality is they're the least likely to go to the doctor anyway, for anything. So it's really figuring out ways in which we can reach those young people to get them to come in. So again, only 22% of young people who are sexually active have been tested for HIV. And so that's something that we really need to change and do something about. So that's where this particular intervention started. So what we're trying to do in this particular program is utilize the social networks of young people who are currently coming into a medical clinic. And so we're working with an adolescent health clinic in San Francisco and having current patients text message their friends. And so this is really about not us coming up with some theory-based message or a way to get young people to talk to their friends. We've asked them, you know what, we're gonna give you $10. Can you text message 5 of your friends and tell them to come to the clinic and get tested? And so what we're looking at to see are 2 things. One is, are we successful at really reaching those young people that are most risky? So we're going to be monitoring the risk profiles of the new patients who come in. And we can do that because we have access to the clinic record. So every patient that comes in, we work with the clinic and built them a server and all the other things. So now every patient that comes into the clinic gets an iPad, they input their intake data, which the clinic would be collecting anyway. They were collecting it paper and pencil, and then a numerical volunteer would be inputting it in. So it really is a win-win for both the study and for the clinic. So then we can monitor over time what the sex profiles of those young people that come into the clinic are. Are they having more unprotected sex? Are these young people having more sexual partners after we start doing the text messaging versus before? We're also looking to see if, in fact, we are able to not only get more risky kids in, but are we getting more positive tests? So are we getting more HIV positive tests, more STI tests? And so those clinic volume measures, are we getting more patients into the clinic? So that's the other thing that we're kind of looking at. And we're getting a lot of feedback before and after. So in terms of lessons learned, we did a small pilot test of this, and there's a couple things that came up. One was most of the young people thought, this is a great idea, this is fine, I feel comfortable doing this. Because one of the biggest questions is, will kids really text message their friends about coming into the clinic? And the reality is, you would be surprised what kids text message each other about. This is like low-level kinds of stuff. So that wasn't an issue. There was a small group of young people who did worry about, well, what do my friends think if I actually send out this test message? And what do I say? And how do I say it? And so, as a result, we came up with a text message guide that's not intended to tell them what to say, but to help them to consider the kinds of things like don't accuse your friend, don't make your friend feel uncomfortable. So things that they should consider when they come up with the text message. But again, the idea is that they come up with the text message themselves. And so there was a number of issues that came up that we were kind of considering and struggling with as we built this intervention out. So one is, there was a lot of issues around the IRB and the adults who were reviewing the grant around, well, what if kids are feeling like they're being cyberbullied or pushed into getting tested, and how are you going to handle those kinds of things? And so in our small pilot test, now as we've implemented this, we've not found this at all. We haven't had any adverse events. However, we have a lot of things set up to try to prevent this kind of thing from happening. So the things that I talked about before, helping the kids to see the text messaging guide. I keep calling them kids, young people. I remember when I was that age, I'm like, I hate people calling me kids. But now I'm old enough that I can call a young person. And so we also asked them to show us the text message before they sent it, because we have someone at the clinic there who can help them if they're trying to figure out what to say, or can say, well, are you sure you want to say that? And a number of other things. A big thing that came up was whether or not we should have some kind of standardized message, right? So there's this whole, should it be theory-based, should it be standardized? That way you know what kids are saying to each other. And the reality is, the young people probably are much more persuasive than anything, even if we had a cab and all that kind of stuff. They know their friends much better than we know their friends. And so they're going to be much more, our assumption is they're going to be more persuasive in trying to talk to a friend to come into the clinic than anything that we could come up with. So that's really our test, is this working? And it allows us to use their social networks. And so I think that's really the power of it, because the young person's going to be hearing from someone that they know as opposed to someone that they don't know. And they're going to be much more likely to respond to that message. Now, this quote is something that came straight out of my reviewer comments, so I guess this is just me being mad. But again, I think as adults, we often don't understand and don't appreciate how young people use technology. For someone of my generation, technology is really a tool to be used, right? But for young people, my son's generation, the young folks that we've been talking about earlier today, technology is part of who they are. It's part of how they express themselves. And so for us to try to kind of fit that into our own conceptualizations, we're really way off the mark. So we really have to be going where the young people are. And then there was this question that was brought up earlier, is did they read the message? And so we're also playing with some things to figure out ways in which we can get information from the recipient of the message. So what have we found so far? So we're out in the field. So first of all, we've found very few refusals. And I'm going to say few, because we're not done. At this point, none of the young people have refused to send the text messages. We give them $10 to send five friends the message. And at this point, none of the patients have refused. But I'm not going to say no one's going to refuse. So hopefully it'll stay few. I mentioned that we asked them to send 5 text messages. Everyone has agreed to send 5 to 5 different friends, and we've had some young people send them to more. So some young people like to send them to whoever is in their, this says 10 minutes, whoever is in their thing, in their book, and in their contacts, and some just choose the 5. We asked if we can check in with them a week later just to see if they've gotten any response from their friends. All of the young people have agreed allowed us to check in with them later to see how things went, if they got any bad reactions. And here's some sample texts that you can read. Okay, so let me just tell you quickly about another technology. We're having a discrepancy in how much time, so I'm going to go quickly. So the other technology that I'm really interested in is games. And you've heard a little bit about games earlier. And I'm going to tell you a little bit about a game that we're using not specifically around HIV risk behavior. Because one of the things that I found in working with young people, particularly disenfranchised young people, is that one of the issues that they deal with, and oftentimes our interventions address this, is emotional regulation. They're engaging in a risk behavior because as a way of coping with whatever emotions that they're feeling. And so one of the things that we are working towards is helping them to learn to cope with their feelings as a way of, and a means of getting at risk reduction in general. So we've developed a game. So that's your teaser. Everyone's giving teasers today, so I figured I'll do my own teaser. But so let me just explain a little bit about what's going on here. So as you can, one of the things is that the young person is hooked up to the game so that their own kind of biofeedback is incorporated as part of the gameplay. So this little monitor up here is their heart rate. So their ability to be successful in the game is their ability to be able to control the physiological reaction to what's happening in the game. So so it's kind of like a first-person shooter game, right? You go in these first-person shooter games. You go and you learn how to use the gun. You learn how to jump out of the hole. You learn how to do all that, how to change your gear, and then once you've successfully done all those things, then they let you go into battle and go kill people, right? So in this game, you learn methods and strategies for reducing your stress level and controlling your physiological reaction to stress. So you learn, this is a breathing master, so he teaches you breathing techniques. Another master teaches you how to use self-talk. So some of those strategies that we would teach young people in person, we're doing in the game. And then once they've mastered these skills, then they go into the game. And so like one piece of the game, they're being chased by a monster, they're picking up coins, and their ability to beat the game, which is what all kids want to do, is beat the game, is their ability to control this little monitor. So you can hear the monster chasing you, you hear its voice, its breathing, its footsteps, and if your monitor goes up, you slow down, and the monster will catch you and kill you and eat you. And so, but if you're able to keep in the green zone, then you're able to stay away from the monster. So there's a bunch of different kinds of interactions that allow you, the young person, to practice the skills that they've learned. Okay. So, just briefly, what we found is that in fact the game, so we did, I probably quickly went by, so we piloted this game in a couple of high schools here in LA, and in Crenshaw and in Compton. And what we found is that in fact the game did help young people. They reported better being able to regulate their emotions after playing the game. And so we let the young people play the game as much as they wanted. And so there was a school that didn't get the game, a school that did get the game. And we found that the young people played the game on average of 4 or 5 hours. And so it did help them with their emotional regulation. So now we're hoping to move this to the next level to figure out if in fact it does actually now help them, if they're able to translate what they've learned in the game to real life and help them regulate their emotions and their risk behaviors outside. Now this very busy slide just basically says that they really like the game. Okay. So, given that I'm almost out of time, let me just say that there is a lot of benefits to using both mobile technologies and social networking. The text messaging that we're doing is really utilizing social networks, but I think these are the kinds of things that we need to be utilizing. Oftentimes, our technologies are still very much information-based and very much, I like to call them, glorified PowerPoint presentations. And so we've seen some really great examples today of how you can move past that. And I think there's a lot of reasons why, and that's some of it. People ask me all the time about, like, what are young people doing? So I'm slowing this up here. It's not necessarily my research, but what we know. So there's research out there that's telling us what young people are doing, where they are, how they're spending their time. And currently we need to, it's not really about the platform they use. We need to understand how they're using these and then how we, as folks who want to do prevention work, can utilize those platforms. Because the reality is, 10 years from now, who's going to be using Facebook? Who knows? Like, my kid's now all about Snapchat and a couple of other things. So all of these things move. So it's not necessarily about does Facebook work, but it's really about can we connect with social networking in general. So this should give you just some sense of that. And since I did say a little bit about Twitter, this is what we know about Twitter. But if you want more information about this stuff, just drop me an email. So lastly, I want to thank the folks who funded this research, NIDA, as well as the MAC Fund, and in particular the young people who share their lives with me. And I don't think we have time for questions, probably, but I'm around. So feel free to come up to me and ask me questions. Thanks very much.